Local and live, covering Franklin and Washington counties, it's Let's Talk TriState with Tiny and Katie.
Welcome back to Let's Talk TriState, all powered by HomeRight Windows and Doors in Waynesboro. Winner in the 2024 Best of the TriState Awards, The Right Choice. Our guest now is from the South Central Community Action Programs Incorporated. Megan Shreve, you're the CEO. Thank you for being here.
I am. Thank you so much for having us. Really appreciate it.
Yeah, of course. We're so glad that you decided to join us. Your website is SCCAP.org. What do you say for short?
We call it SCCAP.
SCCAP.
Yes.
Perfect. You know what? I'm going to write that down because I was wondering exactly what you said, and that makes it much easier.
It's a mouthful to say the whole name. Yeah.
It is. So tell us about SCCAP. What is it? Did it originate with you?
It did not. We actually turned 60 years old this year.
Wow.
So we've been around for a long time. We were started as part of the War on Poverty, and we are one of 1,000 community action agencies across the United States. Every community has a community action agency, and SCCAP represents Adams and Franklin counties.
That's incredible.
Yeah.
Wow. Now, Franklin, Adams counties, how many folks would you say, not that statistically you would know need assistance, but how many folks would you say you actually assist?
Yeah, about 10% of the population come through our doors. So we serve between 17 and 22,000 people.
And how many locations do you have?
So we have main offices in Gettysburg and Chambersburg. We also have, our WIC office has an office in Waynesboro. We have one in Hanover. And then some of our services we go out. So we run a weatherization program, and that goes out to people's homes. And we work in Adams, Cumberland, Dauphin, Franklin, and York counties for that program.
Incredible, incredible. It's a wide reach. And I don't think a lot of people realize the condensed nature of our population. Yeah. It is, the 81 corridor is been booming, is booming. And as this population just explosion really around this area, and it's very, very concentrated in a per capita way for our population. So we're very glad that you're here and doing what I consider to be wonderful work, and I'm sure you do as well. Basically what I have here in my notes, that you provide services such as homeless shelters, food pantries, gleaning, WIC, weatherization. You brought up some of these, Franklin Together, person-centered coaching, and so much more. So let's take that, let's do that one by one and hit some high points if we could. So let's start with I think what everyone would be at least familiar with on its face is homeless shelters. So take us through how that plays into SCCAP.
Sure. So at SCCAP, we try and serve a wide-ranging amount of programs, because what we're really trying to do is put those programs together for the best outcome for the individual. So our goal is long-term stability for the people we're working with.
Right.
And so homeless shelters, people are at their most fragile when they come to a shelter. They typically have stayed with friends and family and are pretty hopeless. And so our shelter in Franklin County is in downtown Chambersburg. It's on Main Street. We have a family shelter in Adams County. But what we do is when folks come in, we try and identify what are the barriers that caused their homelessness. How can we support them in getting to long-term housing stability? And so we'll help them if they need to find employment. If they need other resources, we'll support those. We help them connect with other SCCAP programs along with other communities programs and resources so that they can have long-term stability. And then we start looking for housing. So we'll help them find housing, and then really if they need ongoing case management or they want to stay involved with programs, we'll provide that to them until they're stable.
I saw a video on your website that was someone was doing a walking tour in Gettysburg, and the first place that they went, you were there. Was that one of the homeless shelters? Because I remember you saying these are 7 bedrooms, I believe, or something to that effect. So that's how many of those types of facilities exist? So
we have 2. So we have one in Gettysburg that predominantly serves families. That's kind of what the need has been over there. And then our shelter in Franklin County serves families and serves single adults. Okay. But in both cases, we have rooms. So it's not a dorm. You really have a room so you can, feel safe. And if you have a family, then it's a family room so we can keep everybody together.
That's very nice. And so that's homeless shelters. How about food pantries? It's almost like the order that these are listed are the familiarity people have, at least what we've heard about. I can't wait to get the ones that I have not heard about.
Right.
But let's just, quickly run over food pantries.
Yeah, so food pantries, you're right. When people think of poverty, they think of these kind of programs, homeless shelters, food pantries. And they're important, right? They meet basic needs. If you can't have your basic needs met, it's hard to think about your future.
Well, we think food, shelter.
Yes,
It's the first two
that's
things that most
exactly
people
right.
say, food and shelter.
That's exactly right. And so food pantries, we have a pantry both in Gettysburg and in Chambersburg, but we also partner with local food pantries across the county. So we partner with the Presbyterian Church in Greencastle. We have a church in St. Thomas in Fayetteville. Those are our partner pantries. And so we coordinate the state food program, which receives some funding from the state to support food. It's about $7 per month per family, so not a lot of money. But families can come and get emergency food. So, they can come typically once a month to be able to get their basic needs met. And we found that just wasn't enough. I mean, we know the cost today for food, and we're seeing more families with children and more seniors across our programs just because the economy is so tough. And so as we were looking at the barriers that exist for families in moving out of poverty, we found they lost access to food resources. And so someone in the Adams County community started the program Gleaning, which is one of the programs on the list.
That's the next one.
It's
Right, sure.
another food resource. And Gleaning is amazing because what it does is it goes out after the harvest, and the food that's remaining, we harvest it and we bring it back, and then we distribute it all across the county to food insecure folks. And when Jerry Altoff, who started that in Adams County, couldn't run it any longer, he gifted it to SCCAP, and so we've been running it for about almost 10 years now. And it's an amazing program. Last year, we were able, between Adams and Franklin County, to distribute more than 1 million pounds of produce that would have gone to waste. It would have rotted. And you can get it into the hands of folks. It's healthy foods that both, help someone not be hungry, but it also feeds their, keeps them nutritionally sound, helps them with any of their healthcare needs. So it's really, really beneficial. And that combination, our pantries, which provide kind of shelf-stable items and dairy items and meats, and then our produce, that really makes it well-rounded. And the Gleaning, what's great about that, especially during the growing season, is people can come more than once. So you can come to the produce stand in Chambersburg, we distribute to partners on a regular basis to help fill that need. When
someone perhaps may want to take advantage of that program, the Gleaning, which has a great name for that, it so applies, obviously. What's the process for walking up to the produce stand?
Yeah, the produce stand in our Chambersburg office, you can just come. So there's no paperwork you have to fill out. What we ask is that you only take as much as you need, because we want it to be available to folks. For food pantries, really you're signing a self-declaration of need, saying that you need the food from a food pantry, and that paperwork is just required because it receives some state funding. But there's no, unlike many social service programs, they're not, you don't have to bring your income statement.
Or a waiting period,
yes, exactly.
Things like that. When you're hungry, you're hungry.
That's right, just come get food.
And that's something I think that thankfully a majority of us cannot empathize with. We cannot, we can't sympathize with. I can't say that I've ever wondered where and when my next meal was going to be. Food security is what it's mainly called now, and just imagining that is heartbreaking. And knowing that a person, I just had a couple wonderful ladies from the United Ways of Franklin and Washington County in the other day, and we said, when someone becomes unemployed and they need assistance financially or in whatever capacity, the bill collectors, the landlord does not. That's right. Does not
stops.
Wait.
That's right.
That 15th of the month or 31st or 1st of the month, it's going to come no matter what, and money needs to change hands.
That's right.
So with this, like you said, with the Gleaning, it's such a beautiful thing that it's right there. It's not really. I'll say no questions asked, but it's just very low pressure.
Food.
Let me ask you this: we're talking with Megan Shreve. She is the CEO of SCCAP, South Central Community Action Program Incorporated. What do you find, how do I word this, is the reason that most people find themselves in a situation needing SCCAP services?
So that's going to depend a little bit on the program, but I would say by far, most of the people that we serve are working. If they're not working, it's typically folks who have worked in Adams or Franklin County their whole life and are living on just Social Security. So the costs today are just so high that it's really difficult for someone who is working a low-wage job, maybe in the service industry, maybe in agriculture, hospitality, any of those, to earn enough to pay for their cost of living. We've seen since 2020, rent has gone up by between 28 and 38%, depending on the size of apartment that you have. mean, that's so high.
Oh,
So
yeah.
we're seeing more seniors in our homeless shelters and our food pantries because their Social Security is not covering their cost of living. You know, they're sometimes spending 80% of their income just on housing costs.
Right.
Like, what do you do?
Well, and these people were, you know, they were sold a bill of goods that this would be, you know, I think a lot of people, Social Security was obviously just, you know, meant to be a help, and a lot of people have, you know, they rely on that as almost like the retirement.
Right.
And it's just, it's not going to
not
do
enough.
that. Right. And it's not,
Right.
it's not anyone's fault.
No, right.
There's no blame
Right.
being shuffled around here.
Right.
I'm just saying that it's, to your point, it is not enough
That's right.
to sustain the average person.
That's
You know, my father gets his Social Security, and it's certainly not nearly enough for
Right.
him. I don't, that man, you really learn, he's told me, I haven't had to learn this, but you really learn where to spend your money as wisely as you possibly can. Stretch the dollar, make it go as far
right.
as it goes. And I remember he had applied or received some SNAP benefits. And when he told me how much, it was like $16 a month.
Exactly.
And he said that he makes $20 too much per year. $20 is
It's
apparently
crazy.
there's this delineation.
Yeah.
And I get that there has to be some type of marker. And no matter where you place that marker, someone's going to fall on either side of it. I understand that. No one is, you know, being singled out, so to speak. But it kind of describes what folks are going through and how it is so easy to, it's, you know, paycheck to paycheck. It's deciding between house or food.
That's right.
It's a decision where, you know, we're talking about folks that sadly, you know, they're, like you said, back and forth to work. And they can't make that decision like most of us are blessed to be able to make and say, well, I don't feel like making dinner, so I'm going to stop at Chick-fil-A.
Right.
You know, that's not
right.
even on the radar
Right,
as a
exactly.
possibility.
Yep.
So let's, as we're wrapping up here, let's Megan, talk about Franklin Together. I'm assuming it means Franklin County.
It is, and
Okay.
it really, it's the Reentry Coalition. So it's working, it's pulling together groups who want to see folks who have been involved in the the criminal justice system, be able to come out of the criminal justice system and stay out.
Yep.
So it's a wonderful program. We have a coalition that meets, and then there are lots of groups that are coming together to help folks really reacclimate, to get employed, to find housing. All of those things, those barriers, are more difficult if you have a criminal record. Just like if you have mental health issues, or, you know, if your language isn't English, all of those barriers become much more difficult. And so Franklin Together has been great about helping people get out of prison, stay out of prison, looking for solutions that can make that easier for them, identifying who are those second chance employers, who are second chance landlords, so that we can help them stay out, which is better for all of us.
Sure.
In all of these cases, what's great about the work that we're doing is if you can get a family stabilized, if you can get someone out of the criminal justice system and stable, it's better for everybody.
It is.
So that it's an investment. Sometimes people see the work that we do as a cost, but it's really an investment. And we see time and again, when people can get stable, when they can have hope for a better future, have someone to support them just in the way that they need so they can stabilize, their life is better, and consequently our lives are better.
It's the I need a hand up, not a hand
That's
out.
right. That's exactly right.
And when you bring up, and I didn't know this, so I'm so glad that the Franklin Together program, I'm glad we're ending with that, is I would hate for anyone to be judged by their worst moment.
That's right.
And you know, there's that, you're right, there is that stigma with that employers have, where it's like, oh, you know, I'm sorry, and I understand there are some cases where you just can't.
Right.
You know, laws, rules, things like that, they exist for a reason. I understand, but you know, you have people who want to go to work.
That's right.
They want to become better members of society.
That's right.
They have, as far as I'm concerned, when someone serves their sentence, whatever that may be,
That's right.
they're square with the house when they walk out.
Right.
They've done what they were supposed to do.
That's right.
And who am I to place a judgment on them for anything that they've done moving forward? I'm not even to place judgment on them. That's done. That's signed, sealed, delivered.
Right.
That's over.
Right.
And the problem is, to your point that you just went over a few minutes ago, is if they are constantly turned down,
Yeah.
what life do we think they're going to revert to?
What options exist?
Right.
Yeah. And so creating an environment that welcomes someone and then helps them, you know, create whatever that path is just really, those things are gifts.
Yes.
When you think about these programs and the difference they make for families, even our weatherization program that allows a senior to be able to age in place, to have a house that's warm, costing less to heat and cool. So it's thinking strategically about how do you design programming that really leads to the best outcome for our friends and neighbors.
Yes, and they are our friends and neighbors.
Yes, they are.
We've been talking with Megan Shreve. She is the CEO of SCCAP, the South Central Community Action Programs Incorporated. Megan, before I let you go, and by the way, the website is SCCAP.org. Is there anything that we didn't hit on that you wanted to make sure that we did say before I let you get out of here?
The only thing that I would add is we do have a program called Person-Centered Coaching. So if someone really, they want their family to be stable, they're not sure how to make that happen, they can call us and set up some time with a coach, and we'll work with them on the goals that they have. So they can help you navigate the other systems, the other programs that exist. But thank you.
Yeah, of course. And we're so thankful that you're here. We would love to have you back. Do you take donations? Is that something?
We do, certainly. Okay. We have opportunities for volunteering, and we have donations. You can find out more about those on our website. And that website is SCCAP.org. Megan Shreve, thank you so much for joining us on Let's Talk Tri-State. Love to have you back. Thank you so much. Have a great day. You as well. More coming up in just a few minutes on Let's Talk Tri-State. Let's Talk Tri-State. If you'd like to be featured on an upcoming episode of Let's Talk Tri-State, call 717-597-9200 or email letstalk@921thegoat.com.
I'm Nick Seco from Home Right Windows and Doors, and we're located in Waynesboro, Pennsylvania. So we do vinyl replacement windows, we do steel and fiberglass entry doors, we do aluminum storm doors, and we do sliding patio doors, all made by Provia. The windows are a vinyl replacement window, and it could be anything from double hungs to casements to bay and bow windows and everything in between. So when somebody calls in the office and needs an estimate, they get Roxanne on the phone typically, and she would schedule an appointment for me to come out and take some measurements, provide some literature, go through what options we have, and then I would follow up within about 24 to 48 hours with an estimate with all the details of the products as well as the installed price. I find that we're typically much more affordable than the companies that you see advertising on TV or in a lot of other places. If they're spending a lot of advertising dollars, obviously they're passing those costs on to their consumers. You could go to our website at homerightwaynesboro.com, or you could call us at 717-749-4874.
Local and live, covering Franklin and Washington counties, it's Let's Talk Tri-State with Tiny and Katie. Let's Talk Tri-State.
Welcome back to Let's Talk Tri-State, all powered by Home Right Windows and Doors in Waynesboro, the right choice winner in the 2024 Best of the Tri-State. Our next guest today, we have David Grant, who is the Chief Operating Officer, the COO of Keystone Rural Health Center. Thank you so much for spending time with us today on Let's Talk Tri-State. And to be honest with you, David, I don't know a whole lot about Keystone Rural Health Center, so I'm going to let you walk us through the mission and what is it? What do you guys do?
Great. Well, thank you, and thanks for having me this morning.
Sure.
We at Keystone really appreciate it. So I think I'll start really from the beginning. Keystone Rural Health Center, we go by Keystone Health, is a federally qualified healthcare center, or FQHC. And FQHC, they started in 1965, President Johnson with his war on poverty. And then approximately 10 years later, the Section 330 of the Public Health Service Act was enacted to help fund rural health centers across the country. Today, there are approximately 1,400 FQHCs in the country, serving over 30 million Americans.
Wow.
Yeah, it's they're the safety net, but also in many communities such as Chambersburg, Franklin County, they're also a provider of choice.
Okay. This might be a silly question, but is Chambersburg considered a rural area?
You know, it's interesting. It's shifted over the years. We're less rural than we used to be, depending on federal designation. But in general, there's still areas that are considered underserved, and that's where your FQHCs fit in.
Okay. And what are some of the different services that you offer?
So we have, interestingly enough, Keystone, I'll tell you a little bit about our founder. Her name is Joanne Cochran. Joanne founded Keystone in 1986 with the primary mission of taking care of the poor. She is a former Catholic nun, still very faithful, very active. She's large and in charge.
So she's been there for 38 years.
From the beginning, and we're grateful to have her there as our leader. She always brings us back to the mission, and that's to care for the poor and underserved in the community. That said, she never wanted Keystone Health to be the healthcare provider of last resort. So I always tell anyone coming to work at Keystone, you will see everybody from the homeless through the more affluent in the community, and that's the way the model was set up. So it's not just a safety net, at least in Franklin County. And what Joanne did versus growing outward and moving into bordering counties and otherwise, she increased the services within Franklin County itself. And so we're a bit unique. We're the third largest federally qualified healthcare center in Pennsylvania. Okay. We see approximately 65,000 individuals in a county of 155,000.
That is unbelievable.
So, and we do that through, and I brought my cheat sheet off to be honest, because I don't want to forget anything. We have, our services include family medicine, pediatric speech therapy, pediatric occupational therapy, pediatric audiology, and these are many times children who would have nowhere else to go for those services. We have behavioral health, which includes both psychiatry and therapies.
Is that for pediatric as well, or is that both?
That is adults as well, so both peds and adult behavioral health. Chiropractic. We run the local crisis intervention program, in part funded by the county. We have an urgent care program. We have pediatrics offices in both Chambersburg and Waynesboro. We have a pediatric clinic at Chambersburg Area Senior High School. We have a pediatric dentistry practice in Chambersburg. We have women's care, which is obstetrics and gynecology. Internal medicine, which is adult medicine, so that's anyone 18 and older. Infectious disease. We're fortunate enough in this county to have the 3 board-certified infectious disease doctors, which is unheard of in a county of this size. But there's a strong partnership with infectious disease and WellSpan at the hospital as well. We have a foot and ankle practice. We have a sexually transmitted disease, family planning, and healthy women clinic. We have a dental program, and to say that is doesn't do it justice. In the next couple of years, if my memory and numbers are correct, we will have close to over 60 dental operatories in Franklin County. So think of 60 dental chairs. We also have a seasonal farm worker program. So Keystone cares for seasonal farm workers throughout the state of Pennsylvania. We have 2 sites, physical brick and mortar sites where we do that, one in Gardner's, and we have one in Wyomissing. Other than that, we will do that under contract. So we have an agreement with, say, Penn State, St. Joe's, and they can care for agricultural workers there, and we pay for that through Keystone funding.
Wow. Is there any area in which you guys are looking to grow that you see a need for?
At this point, we're going to grow our footprint, but not necessarily our services at this stage.
Yeah, you have a pretty wide variety there.
I also didn't mention that we have a pharmacy. We have our own retail pharmacy that is open to the public, and we have a navigator program. So if you don't have insurance and you don't know where to go, you can come to Keystone and we will help guide you. I have a personal story about that. Prior to working at Keystone, I had my niece who worked. She went to college. She got out sort of in between, trying to figure out where she was headed. She was working at a local restaurant at the time, did not have health insurance, and she was in her mid-20s. And she said, Uncle Dave, what am I going to do? I don't have health insurance. And I said, I heard of this place called Keystone Health. I said, I didn't know much about it at the time, but I understand if you go there, they will provide care for you on a sliding fee program, which is what we have. And so she was able to go to Keystone, see the navigators, provide her information, and get excellent care at a price she could afford. based on her income at the time.
And she's not an anomaly. You know,
No.
mid-20s, early 20s, trying to figure out their career path, what you're going to do. I mean, I was there as well.
Yeah.
Now, with Keystone, is it specifically for people who do not have insurance, or is it for anybody?
Anybody.
Okay.
Yep.
And so if somebody is from a lower like socioeconomic status, or they don't have insurance and they come into Keystone and they need care, I know you touched upon this earlier, there is some kind of way that you work financially then so that they can obtain the services needed.
Exactly.
How does that work?
So federally qualified healthcare centers are the governing body is HRSA, Health Resources and Services Administration, so HRSA.gov. And we have to have a sliding fee program based on income. And that sliding fee program, we have to test it periodically to ensure it's not a barrier to care. So patients can come in and potentially have a nominal fee associated with a visit. So maybe you and I might have to pay $30, for example, for a primary care visit, whereas we can put somebody on a sliding fee and they can pay much less than that. So I hope that answered your question.
Yes, it does. Because I know even with insurance, if I have to go see a foot doctor or even the dentist, I mean, it can be wildly expensive with insurance.
Indeed.
Yeah.
In fact, on our dental wait list, I think, you try and keep a wait list the best that you can. We have approximately 3,000 people waiting for dental care.
In Franklin County. I think that's the part that's kind of blowing my mind is it's just in this small little county.
Right. Hence why we're building.
Yes, that's great. How many physicians and providers do you have at the moment?
So we are likely up to at least 125. And that would include doctors, therapists, nurse practitioners, physician's assistants, dental hygienists, dentists. I'm sure I've missed a couple, but yeah, we're well above 120, 125 at this point.
Are there any employment opportunities with Keystone?
We're looking for dentists.
You're looking for dentists.
Yeah. We've been grateful that we've been able to hire most recently. We were able to hire family medicine, internal medicine, so we're very excited to see those positions starting here this year. So when you hire a physician, there's generally a long lead time. Physicians typically don't move, and especially don't move to rural communities. If we were in a larger city, it's more plentiful.
Yeah, there's more financial
no matter what.
There,
rural medicine is difficult. Although what's fascinating is generally the salaries and benefits are higher in rural communities because it's harder to recruit. So
there's a more incentive.
A little more incentive to come here, but amenities are always important. So we've been grateful. We've been able to hire family physicians. Actually, we've been able to hire dentists here recently as well. We'll be looking for dentists in 2026.
Okay.
So just to back up a moment, we have two big projects coming in the next couple of years. On July 1st of this year, we'll be opening a center at Catherine Street in Chambersburg. That center will have, the bottom floor will have a behavioral health urgent care walk-in program, as well as some scheduled visits. A medical urgent care on the first floor. Second floor will have 10 dental operatories, so a dental office with 10 chairs. The outreach program, which will be the STD Healthy Women Family Planning Program, will move there as well. It's now at 111 Chambers Hill Drive. And then the third floor is Keystone Family Medicine, but we have a partnership developed with WellSpan for family medicine residents. So we'll have a residency program in concert with WellSpan at that site as well. In 2026, we're going to be, actually very soon, hopefully, we'll be breaking ground on a center on Welty Road behind Tractor Supply. And that center will have, I hope I don't miss anything because it's hard to keep up with, the gentleman who builds our buildings, John, I don't know how he does it, John McElwee, but he has built many buildings in this community for healthcare. We're going to have internal medicine, pediatrics, foot and ankle, chiropractic, pediatric developmental center as well at that site, and likely some behavioral health. So the need is there. If you in behavioral health, what's fascinating is if you have means, you can probably get an appointment with a therapist tomorrow. But if you don't have the means to do so, it could take a year, 2 years.
It's interesting that you are touching upon the behavior therapy piece, because I wanted to as well. Coming from somebody who I had anxiety my entire life, and I go to therapy pretty regularly. For me to get in with my therapist took me over a year to find her.
Right.
And she's a good one, someone who is very qualified.
Sure.
So I can imagine, I think there is such a need for mental health, behavioral health that isn't readily available to the public. And quickly, you need it quickly,
Right.
not in 6 months. If you're having a nervous breakdown, 6 months isn't going to help you out.
Right.
So I wanted to ask you, you said that in July 1st of 25,
Right.
in the new facility,
Correct.
you're going to have a behavioral health floor and then a medical floor. Is that something that you have separated out now, and you're just moving the services over there?
We do. The piece that will happen in July, both the medical and the behavioral health urgent care programs are going to be on the same floor.
Okay.
So they're adjacent. And as it goes, the best laid plans. We believe we have it staffed. So theory is, let's just say you had a traumatic event in your life. Whether it would be a divorce, a child
Death,
creating problems,
something.
death, job loss, what have you. You can walk into this center and immediately access some behavioral health resources. It won't be as full as the overnight stay type situations, but you should be able to access some resources, and we can guide you then, and hopefully get you into treatment much sooner.
That's
than
wonderful.
Otherwise.
I think there's such a need for it, and I'm happy to hear that. That's really great.
And the crisis teams tell me that the majority of the crisis visits we see today, our crisis is located in Chambersburg Hospital's emergency department. Adolescents.
Oh, absolutely.
Yeah, right. It's not a surprise.
Absolutely. Wow, that's wonderful news. Lots of big things happening for Keystone. David, before we wrap up here, is there anything else you want to touch upon or share about Keystone before you kind of just give me where people can find you if they have questions?
I think in particular, I've been with Keystone now since 2017. Healthcare is difficult, no question, no matter where you're at today. But whenever I walk around the halls of Keystone, it was true in 2017 and it's true today, you feel the mission. You feel why people are there. And to me, I'm grateful to the staff and all the senior management at Keystone for that.
That's great. I mean, I think
and Joanne's vision, just to continue to care for the poor and really anybody who needs health care. Like I said, we care for everybody from the homeless to the most affluent in the community.
And I think it's good to do it with grace. And I think sometimes people forget that bedside manner or how stressful it can be to be getting medical care. So it sounds like Keystone is a nice environment where you feel comfortable. And
it is.
Great. Wonderful. So then if somebody was thinking, okay, Keystone's for me, how would they find you and get started with them?
So we have mechanisms. You can call I would direct you to keystonehealth.org. Depending on which type of practice site you're looking for, you'll see all of our services there. We have the ability to text. So if you want to text that phone number, for example, Keystone Internal Medicine, Keystone Family Medicine, and you want an appointment, we have the ability to do that. If you're busy during the day and you can't be on the phone, you can text us for appointments. You can call our phone numbers. We do have a patient access center that does scheduling for the majority of the primary care sites now. So it's one call to one location, and if they can't get you in at one site, they'll try and get you in at another site. So I would just direct you to the website or call those practice sites directly.
Well, thanks for what you do and for sharing all that great information with us.
Thank you for having me and highlighting Keystone today.
Of course.
We appreciate it.
Yep. We'll be right back with Let's Talk TriState.
Let's talk TriState.
If you'd like to be featured on an upcoming episode of Let's Talk TriState, call 717-597-9200 or email letstalk@921thegoat.com.